Hello there, this is Esther James again from NTR TV, and we are bringing to you KORU Hospital. The last time we had the KORU Hospital, they told us about what the hospital is all about, the technologies they have, the location, the history of this wonderful hospital. And today is not just about the building, the location, what are the services they render. They also have different departments, and we are honored to have one of I would say one of the doctors, one of the professors that will tell us more about the most important part of the human body, which is the heart. So we are bringing this special information from the Heart Center of KORU Hospital. Sir, thank you very much for having you on NTR TV.
Hi.
Thank you very much. Can you please introduce yourself proper to our viewers and also about this Heart Center?
I am a Professor Dr. Sinan Altan KOCAMAN, founder of KORU Heart Center. I am a specialist in interventional cardiology and cardiac electrophysiology. KORU Heart Center consists of cardiovascular surgery and cardiology clinics, and it is located in central position of Ankara, capital city of Turkey.
Wow, it's amazing for me to actually know that you are the founder. So it's getting the information right from the founder of the center, which is it's amazing. So don't go anywhere because the heart is very sensitive in the human body. So what are the advantages of having this heart center? I mean, we have a hospital already. What's the advantage of having the center for just heart?
Cardiovascular diseases are globally common and cause most death and loss of workforce in societies. For this reason, primary prevention, early diagnosis and treatment of these diseases are important of heart centers. Being able to perform a wide procedure with expert medical doctor and medical assistance personnel has facilitated patient trust and patient follow-up from a single center. Another important point is that KORU Heart Center works in integration with emergency call system, so that unpredictable cardiac events can be treated any time of the day.
Thank you very much, sir. Can you give more information about the technology infrastructure of the Heart Center?
In our Heart Center, all diagnostic and therapeutic medical device infrastructure provided by technology is available. With our expert medical staff, we are able to offer a wide procedural diagnostic and therapeutic plan to our all patients. We are aiming to prevent any unpredictable cardiac events in especially young population with our vascular age and structure controls, which is we have developed with our experience and foresight.
Oh, that's amazing. Generally, you made mention that the need for us to have a specific focus on the heart.
Cardiovascular diseases are very common and unpredictable cardiac events in this specifically young population, induced to a sudden death, unpredictable loss for family. We have to decrease this disease maybe with our vascular age and structure controls.
There are so many diseases that affect the heart. For this center, which particularly you are focused on, or you focus on the general heart diseases?
Yeah, heart centers in Ankara generally central position of the city, and specifically our center interests arrhythmia treatment, vascular interventions, congenital heart disease, etc. Yes.
Okay. Which structural heart diseases are treated? Like the structure of...
In cardiology and cardiovascular surgery clinics, except for routine inpatient and outpatient services, very sophisticated procedures have been successfully applied in diagnosis and treatment. For example, coronary artery disease, peripheral arterial disease, coronary carotid artery stenting and renal artery stenting, closure of congenital heart defects, for example, atrial septal defect, ventricular septal defect, patent ductus arteriosus, and patent foramen ovale, for example, and clip placement in some insufficiency of valves, for example, tricuspid and mitral valve. We called it mitra clip and triclip, and TAVI procedure, a very important procedure, non-surgical aortic valve replacement, EVER procedure. Recently we use which is graft implantation in the aortic aneurysms. Maybe all type arrhythmia treatments and device implantations and opening of the heart valve with stenosis, alcohol septal ablation for hypertrophic cardiomyopathy, which is the congenital disorder, inherited disease, and maybe pulmonary hypertension treatment. And maybe I remember a renal denervation. In recent years we use for resistant hypertension.
Wow, you mentioned a lot of them that I have never heard in my life before.
Yeah.
But in general, as a professor, this is what you've been doing for a very long time. I'm sure there must be a particular one that is very, very common. Maybe it's usually caused by the ignorance of everyone. So which among these ones you mentioned, which one do you think is more often? And it's the major issues. Yes.
Well, generally, in the field of cardiology, very often disease is atherosclerotic heart disease, coronary artery disease, peripheral arterial disease, renal stenosis. But second step may be hypertension, diabetes, hyperlipidemia, and related disorders, cardiac arrhythms and ablation treatments. But we mainly works on atherosclerotic heart disease, coronary artery disease in heart center.
Yeah. So is cardiac arrhythmia?
Yeah,
forgive my
my
pronunciation.
Heart rhythm
These are words
disorders.
I'm not familiar with. a cardiac arrhythmia treatment.
Yeah.
And pacemaker application performed in your heart center.
Yes. My specific experience in the field, in our heart center, 3D, 2D conservations and 3D complex mapping of the arrhythms, heart rhythm disorders, and ablation treatment, conventional and complex makeup systems, and implantation of all kinds of pacemaker widely applied in diagnosis and treatment of this disease.
You say pacemaker, I was like, just imagine.
What is a pacemaker?
Yeah, pacemaker.
Past years, first pacemaker can pace the heart, increase the heart rhythm, but in recently intracardiac defibrillator for the ventricular tachycardia treatment, and recently cardiac resynchronization treatment. It's not pacemaker, or it is. It can treat the heart failure, and in future maybe we most common use leadless pacemaker in the heart.
So it's a technology.
Yeah, but now all type of pacemaker and all type of cardiac defibrillator, intracardiac defibrillator, and cardiac resynchronization treatment widely applied in our heart center.
Wow. So how is this surgery being carried out? How do you do it?
No, it is not under the general anesthesia. I perform generally local anesthesia. Generally, I implant here under the skin on the muzzle, and introduce leads in the heart.
Yeah.
The device sends to your heart by the leads, and after that treat the problem in the heart.
As you're talking, I'm imagining inside the heart of human being, like.
Yeah.
I mean, it's something that you do. Is a profession. It's something you studied.
Yeah,
so
yeah,
you speak about it the way I'm speaking on TV.
Yeah,
like it's just normal thing.
I understand the problem, but we generally focus on the treatment of the patient's problem.
Yes. Do you think with the human, we need to take the heart very, very, very serious? Or do you think human, we are not taking the heart as serious as we should to prevent these diseases from our body?
Yes. Primary prevention very important for us.
Yeah.
Because after the disease is occur in the heart, in the body, yes, very sophisticated treatment exists, and we use that, but we have to prevent primary disease occurrence.
From the total body, not just about the heart alone.
Yeah.
Right. So in general, patients from abroad and for your centers, do you have international patients coming for this treatment here?
In general, patients from abroad come as a referral hospital to our center and get their treatments. We request treatment of too many diseases, including interventional cardiology area and implantation cardiac devices and all type of ablation treatment for cardiac arrhythms, and minimally invasive surgery and robotic surgery. In our hospital, in our heart center, also cardiovascular surgery department exists and has very innovative surgery portfolio, such as all type of conventional surgery and minimally invasive surgery, as well as robotic surgery. Apart from this team can perform outpatient clinic for varicose vein disease in routinely.
Thank you very much, sir. And I hope our viewers will be able to have this information very informative, and see how they can come over to have their treatment for the heart. So briefly, KORU has I say KORU Hastane is in Turkish. KORU Hospital.
KORU Heart Center.
KORU Hospital. It means if you are going to have this surgery or treatment for the heart, you just need to contact the KORU Hospital, or you need to contact the heart center, or what's the connection between the two?
Yeah, communication exists. We in our heart center there is a coordinator person. Coordinator person connect to international areas, media, international media, and KORU call center connect to doctors. What is the problem? Divide the problem to doctors related to heart surgery or heart rhythm problem or coronary artery disease. Second step, we interest problem and patient connection in patient or outpatient treatments.
Okay, thank you very much for your time, Professor, and we hope to come and interact, because I have a lot of questions, more than what I have on my documents to ask, so we hope to get more details. For example, the heart is very delicate, it's very sensitive, and for international patients to think of going to another country for this treatment, it means the situation has gone beyond what they can handle at their place of residence. And usually the distance is so far before they start coming. Is the heart. It means at any given time it can just shut up. It can shut down. How do we handle this kind of thing? I'm sure our viewers will be wondering.
We handle this problem that before the patients come into Turkey or Ankara, will send documents or its problems by the WhatsApp or media. Firstly, we check the problem and invite the patients to Ankara in our heart center.
Oh, that's good.
Yeah.
So the
pre-medication is important, pre-information.
Okay, so that they will take it step after the
firstly, we check that problem, and it's okay. We invite the patients
to come.
Clinics.
Following the history of this center, this hospital, I have seen that it has a very good location, and which will make it very comfortable for the international patients, especially from Africa, where NTR TV major broadcasts at. So we are hoping that if we have more information or people need more information, we definitely contact the heart center. So before I go out of our program, what is the advice you can say? Esther, take care of the heart, avoid this. Is there anything, a doctor, if you have the permission to tell people, don't do this because it affects the heart?
Yes, we generally recommend all patients moving in the 10,000 steps every day, and dietary recommendations very important to prevent any cardiac vascular disease. Very important in the decrease the sugar and oils, and increase to take protein consumption, and mood is very important in life for everything. And after normally lifestyle changes, some patients also can will ill, but we are mainly focused to treat any problem in the heart.
I see. Thank you very much for your time.
Thanks
you so much.
Thank you.
Hello viewers, you have heard from the doctor, the professor, the founder himself about the heart, and I'm telling you, before the program, he actually had to attend to a few patients. So the heart is a very delicate part of our body. Know that if you need a special treatment, if you have any disease of the heart, of course, not the heartbreak, okay, the health one, you feel free to contact the information on the screen. If you could not find the necessary information, you can still contact the customer service of NTR TV. We will direct you straight to the professor. Now stay tuned and don't go anywhere. Keep watching NTR TV as we bring to you more details, information, doctors, all the doctors from every different department from this hospital. To you, our viewers, you have a wonderful day.